There we go. So, hi, Susie. Thanks for meeting with me, or
Hi.
me for meeting with you. So, you had some great questions that were really relevant, I think, to our going into week 9. So, this week, we're taking our PICO question, finding our keywords, right, and trying to see what kind of evidence we can find. So what kind of questions did you have? I actually prepared a PowerPoint and put them on there. So let me find my PowerPoint.
Oh, good, because I was going to have to pull up my email.
Yeah.
Which I can do too.
Can you see that okay?
Yes.
All right. So you would ask some questions. I just wanted to pull this up to give us the context of where we are this week, and then we'll go on to your questions. So really, in step 2 of where we are in the class is to conduct a literature review. So we're going to look through databases and retrieve evidence. So first, what we have to do is really look at what the keywords are. So keywords are like tags that articles have on them. So when you go into PubMed or even Google Scholar, you know what kind of main words to put in so you get the right articles to pop out. Otherwise, you're just going to be getting thousands and thousands of articles that might not be relevant. So the directions for this part is to identify your keywords, to fill in table 2.1 on page 34 of Pollitt and Beck to identify your keywords, then enter these into databases, enter your inclusion-exclusion criteria, and this might be something like the years, the language, any other things, and then to illustrate all of this on a Prisma diagram. So your questions were awesome, and thanks so much for asking them. And I'm sure your classmates have some of these same questions, so I thought we could record this and show them our video. So you said you've been searching for a lot of evidence, and you've looked in 3 databases, and you found about 60 articles, and you have saved about 14 or so. So, and then you said, should you search more?
Yeah, I'm not sure, like, when do you stop? When do you feel like you have enough?
Well, you know, if you're doing this for an actual evidence-based practice change at a healthcare setting, you have to do, really have to make sure you do a comprehensive review. Should you change practice or not, you need to make sure you're finding everything. Mm-hmm. But for the purpose of this class, I just want you to know how to actually do this. So what I was thinking is if you find about 14 to 15 articles in your search, that would be great.
Okay, so like after you sift, you're left over with 14 or 15? Right. Okay. And so, so my PICO question is chronic illness and whether school nurse case management impacts or affects absenteeism or performance at school. So I have like 4 different variables. Like they've got the chronic illness.
All right. Yeah, let's walk through that. So I was just saying articles you should have for your final Prisma are 10 to 15, but I just wanted to step back a second and say for next week when we do the critical appraisal of articles, you're only going to take 4 or 5. So the best 4 or 5 from these 10 to 15, and then you'll do those checklists on each of those 4 and 5.
Okay, is that the JBI checklist that we're doing on 4 or 5?
JBI has many checklists. They're very clear and easy to use. So I would recommend using those, although there's other checklists available out there. Okay. But if you go to the JBI site, you know, it says right there, here's the checklist for a randomized control trial. Here's the checklist for a qualitative. Here's one for systematic review. So it's really easy to just pull those up and fill them out. So.
Oh, okay. So, so the one we did for our assignment was more general.
It was, no, I think you used the JBI systematic review one.
Oh, maybe we did. Okay.
Which works well for just any kind of review. So I'm just pulling this up and pulling it over. So can you see that? I don't think you can. Is it saying?
No, it's just black.
Okay. Let me do a pause share and a new share. And I'm going to share desktop one, share screen. And then if I pull this over, now can you see that?
No, I'm still seeing just black.
Oh, resume share. Okay, how about now?
Oh, yeah. Oh, there we go.
Okay, great.
Yeah.
So you can see here they have critical appraisal tools, and this is the JBI site. So there's one for case report, cohort studies, economic evaluations, quasi-experimental, RCTs. This is the one you guys used last time.
Oh, okay. Okay, and that's one thing too. I've only come across one systematic review, and then another one was not, it just, at the end of it, they said there wasn't enough information to really do anything.
Right. So this was your first question. So you said, what if you come across these reviews and they say there's not enough evidence? Do we include these or should we exclude? So really, if you think about, first of all, you have to evaluate this systematic review. And if it's high quality, which you can know that by doing the JBI checklist, if you've gone through that checklist and at the end you say, I'm going to keep this study, I'm going to use this study, remember that final, those three. So if you've evaluated the systematic review, you say it's high quality, then you really have to use that because it's a high quality study. So you're going to trust the findings of it. It's very robust. So if this robust study is saying that there's not enough evidence, then that has to be your conclusion too, right?
Oh, okay. Okay.
So if you were to not include that because it doesn't show the results that you wanted, that's called researcher bias, is where you pick and choose things based on what you want. So you have to take the evidence available and make decisions based on that.
Okay, that makes sense.
The other thing I was kind of thinking though is what year was that systematic review? If it was from 2012, well, if it was published in 2012, it probably researched studies up until about 2010 because it takes a couple of years for articles to get published. So there might be studies that have come out since and weren't included in that systematic review that show something additional to it. So really when you're doing a review of the literature and you find a systematic review that it fits exactly what you're looking for, but it's old, you just want to see if there's anything additional, and then you can look at that systematic review plus any additional studies and then come to your conclusion on if you should change your practice or not.
So even just a couple of years since it could change the
it's just so amazing how old new stuff gets fast, so with all the internet resources right now, everybody's sharing really quickly, across the globe. So there's something came out in 2018, it's going to be old in 6 months.
Wow.
Yeah. And there's a lot of people doing great research, so.
Yeah, I feel like, the field of school nursing really is lacking. I really wasn't finding very much at all until I found that one database, but definitely not the high level stuff, not systematic reviews. maybe a randomized controlled trial, but definitely lower. So then you end up with saying, well, I don't have like a high level of evidence, but this is what I've got. So now what?
Right. And so I think that kind of segues into your next question, or one of your questions was, if you're looking at the use of case management in school children, and there's not enough in that population, can you take what's been already done in the general population? So I did a slide on that one. Let me see. So you asked, right, just what I said. So can you take information from the general population? So really what we know already is care management is evidence-based. There was this great nurse, Mary Naylor, who went through all the steps of a research design and came and found that care management, case management does reduce costs, reduce admission, has better patient outcomes. So now we have insurance companies that will pay for care management because of the work she did, and there's some other models out there for care management. So we know already that care management is evidence-based. So you specifically want to use it within a school population. So your question was, among children with chronic health conditions, what is the effect of school nurse case management compared to children with chronic health conditions who receive no case management or usual care, right? Because they don't usually get that. On absentee or performance. So for you to step back and say, okay, I don't have enough, I'm not finding enough evidence on school management, and just step back and say, well, what is the evidence for care management in general? You're going to find way too many articles. You might find, over 100,000 on care management in general. So, you wouldn't want to just look at that, but you could say, hey, well, what about, let's look at just care management in school-aged.
Okay, yeah.
So just say, not what is the school nurse case manager, but what is the care management on this age population?
Okay.
So that's a filter that you add on. It's one of your keywords, and that helps you to, kind of tease out those studies that are more relevant to what you're looking for.
Okay. So I could use maybe one or two if it was good research for the school age population with chronic illness.
Right.
And it's case management, not specifically saying school nurse, but
right.
But we know that it's impacting them.
Right.
I mean, if that study said it's impacting them with performance or absenteeism. Okay.
So you're not specifically looking at, that the school nurse is doing this care management, but somebody is managing this person, this kid, and what's the effect of that?
Yeah, because to me, it seems like you could professionally translate those interventions into a school nurse role.
Right.
Okay. I don't know if professionally is the right word, but yeah. Okay, so okay.
what I thought we might do is, just for the benefit of anybody else who might watch this, is just kind of pick out your keywords that you might look at, and we could actually run a little search too.
Okay, all right.
So if we have this, I guess really the first step, if you're looking at your keywords, is to go to that table on page 34 of Pollitt and Beck, and it lines up the type of questions. I'm just going to put this here so you can see that. You're looking for your book, but I'll also show it here. So on that column to the left there, it says what type of question is it, and then it tells you kind of the fill in the blanks this way.
Yes. So
what would you say your question is? What type of question is it? Treatment and prevention?
Yeah, I think it's intervention, because the intervention is the case management.
Yep, I agree.
Yeah, that one was actually kind of easy for me. I was, oh, that was, yeah, okay.
Right. So I just put up another little resource here and a link down here. So if you're not sure what kind of clinical question you're asking, you can kind of look at the list that they have here, and then also table on page 34 has this group, and then in page 16 to 17, it describes each one of these categories. So if people aren't sure which type of question they have, they can read the definition of each one of those. So yours is pretty clear. I thought maybe it was causation or prevention, something like that, because we're trying to prevent any kind of complications from the chronic illness, but you really are going in there and you are providing somebody with some level of care, and then looking at how that outcome there. So that is treatment intervention. But I had to actually stop and go into and read some of these descriptions, and I said, yeah, that's pretty clear. I think that treatment intervention.
Okay.
So then we would go in here. This comes from the Pollitt and Beck book. You'd say in blank population, what is the effect of blank intervention in comparison to on the outcome? So I just went through and underlined these things here. So I thought about if we're doing a search and we said in children with chronic health conditions, we could say children, chronic health conditions, and then we'd look at maybe not so much school nurse, but just case management.
Okay.
And then maybe just outcomes.
Oh, okay, that's a good one. Outcomes.
So if you have these keywords, you can go to the APU library, and then we can actually do a search. So you want to do that?
Yeah. I'm gonna just pull up my Word. Can I pull up a Word doc while we're doing this?
Yeah.
Because there was one phrase that I was surprised gave me so much, and it was something case management. I think it was school nurse, but let's see. Oh, I don't actually know how to do that. I think I'm afraid to leave. Well, can I minimize? Maybe I can minimize. Oh, I'm afraid to leave. We'll just go with this.
Okay. So let's first of all think about getting to the library. So if we go to apu.edu. And did you have any trouble doing this part when you went into the library and searched?
No, actually, and I went right to the Cochrane Library because when I was reading that article by Stilwell, that's where that nurse went, to Cochrane Library. Oh, because I was looking for systematic review. And I found a few there, but it was challenging. And then I think because I've looked in Sinal quite a bit, I haven't seen much. Then I just scrolled down to look at the other databases, and I saw public health. And oh my goodness, then there was a whole bunch of stuff, because I realized school nursing really is public health, but it's kind of its own little niche for research.
Yeah, it could fit in both buckets, really.
Yeah, and I looked at education, and I found nothing. I found a lot of books for under education.
Right.
But, so yeah, it was good. Kind of, I'm thinking all these years I've been doing this master's program, and I'm only now in this class that I realized where to find good.
Yeah, I guess it takes a while. It takes some practice, and sometimes you stumble upon things and other times you don't. So
well, it seems like this class might actually be even better if I'd taken it first or second instead of towards the end, because we are doing research on all these things.
Right.
And I'm randomly looking for stuff. So,
right. So this kind of takes some of the randomization out of it. If you do, if you find those keywords, that's a good start. A lot of times, I will admit, I just go into Google and I type in what is evidence-based practice for blah blah blah, and then we'll see what comes up. But this is really a more thorough way to do it. But I think if we go in.
Oh, the library, I had to call the library a few weeks ago because I kept getting articles that I couldn't see, and then I had to request them, and it was taking days and days. And so as I read through something, I think one of the videos we watched, being able to qualify my search and put in text only, then I only get ones that I can actually.
Yeah, but that's really not recommended though, because then you're basing your evidence upon what the AP library has for you to access, and you won't get all the other ones. So you really want to make sure you don't click that off, and you would have to request it.
Okay. So, but then I guess when you're reviewing, then you're only looking at the title and the abstract anyway to see if it's going to fit.
Right.
Okay.
Right. Exactly. And we'll go through that. So now we're into the library, and I think we go to articles and database, and then Medline is usually a good one to do a first search in. So we'll go to view all databases.
Now, do you go to all subjects and put in nursing or just?
When I put in the keywords?
And then choose database by subject or major? Do you just put all?
No, I just went to Medline, but.
Oh, okay.
So Medline has, it contains PubMed plus CINAHL already. So I'm not sure, it might even have the Cochrane review. So Medline is a great all-encompassing database to look through.
Okay.
So we'll click on that. And here you can choose a specific database within Medline. So you can see all the ones that are in it, but it has Psych Info, it has CINAHL. So you can just look at those specific ones, or you can look at all of them. So what did we say here our keywords were?
Children.
Okay.
And chronic health conditions. And
so I see that here they say chronic illness. So maybe that's something that turn up a little bit more than chronic health conditions. So I'll put chronic illness. And then
case management.
Okay, case management. There. So let's search. So I got 280, so that's too many. So we have to put some limiters on. So we thought we would do, how about if we just look at the last 10 years?
Okay.
So you can see scrolling across the bottom there, you can select the years. So that's something you might want to write down and say, okay, when we're going to do describe our search in our final EBP presentation, part of the directions are that you describe your search in addition to showing it in the Prisma diagram. So you might want to say, you entered these, you came up with, and then you also use the filters. So we are using the filters for the last 10 years. We do not want to do the full text check because, then we might miss out on articles not available through the AP library.
Okay.
But I only speak English well. I do speak a little Swedish, but I don't think I'd be able to interpret a research article in another language other than my own. I can't even do that very well. So we could go and look here and show some more results because we still have quite a few. We have 144. So let's narrow this down. We can go
age. Oh, well, age was already part of children. Would you maybe put less than 18 or something like that?
Yeah, let's see what we can have. If this is our search options here, we can say English. Why don't we do, are you looking at child 6 to 12?
Well, it's pretty much
adolescents
here it is. All children 0 to 18, I think.
All right.
I mean, I guess it would be 5 to 18, but I don't see that one.
Okay, can do all, and then we can do another search.
So this just keeps, I didn't notice it keeps narrowing it down.
Yeah. And then if we want to look at things like more specific to nursing, we could go into the CINAHL or CINAHL. And when you check these things, they sometimes have different filters on it. So I was thinking we want to make sure that we're only looking at peer-reviewed articles, right? So we could click peer-reviewed and human. And then let's see what we come up with. Oh, this took this away.
We don't, where it says animals, I guess that's just going to pop up.
There?
Yeah, well, then I saw all, but I guess it doesn't matter. We're not going to have animals anyway.
Yeah, and this is where choosing what to include. So we don't want to, yeah, not to exclude. So we want to include that group of children, right? Studies on that. We want to include everything that's peer reviewed. There's a whole bunch of choices here, but let's see what we get now. This is in CINAHL, so we have 60. So are we looking at case management or care management?
What do we call it? Here's my PICO question. We could put school nurse. It says case management. I think that's what we call it in California, case management. But
case management.
Yeah.
I think, you know, with the NAILR evidence-based, it is care management. Case management is something a little different.
Okay, actually, and care management is, yeah, because case management involves a lot of discharge planning and that kind of stuff.
Right.
Okay.
Care management is, there's specific elements to it that that are a little different than case management. Oh, I don't know why that turned that off. So let's go to 2008.
So you know what I started doing instead of chronic illness was just choosing asthma and diabetes, because those seem to be the two prevalent ones that, even though I know, I mean, there are so many chronic illnesses, but those are the ones that I just know impact school attendance and performance.
Right. Yep. And that you could do, especially if you have so many. Here's one: perceptions of patient education during hospitalization, all chronic illness, solid organ. So we're getting a lot of things in there that doesn't look like we really need. I was thinking geography, since the U.S. system might be different from other countries. Maybe we just want to choose the U.S.
Yeah. Okay.
Make it down to 60. Was there anything else that we could add to the search?
You know, what I came up with in the public health one was impact of school, what was it? Impact of school nurse. Impact of school nurse seemed to draw a lot, but that was from that other database, the public health one.
Let's see. So now we only get 10. So barriers to asthma management. So that's like a bite-sized chunk, I would say, if you use those 10.
So would you just take these 10, or would you, you still need to sift, right? Or just try to find the best out of these 10?
What you can do for this assignment, you know, is you can keep track of this. You can either do that by, if you sign in, you have folders there that you can save stuff into if you create an account, or you can share this link here you have a permalink here, so you can cut and paste that somewhere, and so you can always come back to this search, but maybe then go in and just search a few more databases with these same terms, the same filters, just to make sure you got everything.
Okay.
And then from there, go in and take a look at the abstracts. And so we'll look here at the abstract. Childhood asthma is growing. Purpose of this integrative review. So are you including integrative reviews?
I think so, because aren't integrative also under the bigger systematic review?
An integrative review is not as robust as a systematic review, so they're not as high quality. So if we go into levels of evidence here, let's see, I should know this, qualitative study or systematic review.
Oh, there it is. Oh. Oh, so a systematic review of qualitative descriptive study?
Qualitative study or systematic review.
So integrated, so it's a level 5. Ugh.
There it is, yep. So that's more of a level 5.
Which is pretty low, isn't it?
It's pretty low, but then, I really like this website, and I will put a link to it in the slides, because it says here, this is the clinical question that you're asking here. So this is the kind, if you're asking a therapy, etiology, based on this type of question you're asking, this is what kind of evidence you would need to change your practice. So if we're thinking about this as more of a therapy.
Yeah. So really more randomized control.
So that's what we would probably need for you to say, okay, I'm going to implement care management in schools.
Okay.
So if we go back to this one, it's an integrative review. So, I guess you would put this to the side and say, well, should I use it or not? So how many articles do I have? And do I have enough? So, here it says too on this page, you might not always find the highest levels of evidence. To answer your question, when this happens, work your way down to the next highest level of evidence. So is that next high level of evidence something that is really well done and relevant to your clinical question? So, I think when we talk about evidence-based practice change, there's really 3 things that go into the practice change. And so, let me pull this slide up quick. So here we think about, we have the research evidence, we have clinical expertise from patient assessment as well as use of healthcare resources and patients' preference and values. So we have to make sure we don't get so stuck on having this high level 1 evidence and forgetting about patient preferences and values, right, and clinical expertise. So we have to make sure, if you're finding an article that says about how the patients or the students at school so appreciated this care management, and you as a school nurse really noticed how well care management is working, that kind of plays into your clinical decision making as well. So it's a combination of all of that.
I think I have an example. So school nurses used to do scoliosis screening in California and also look at BMI, because of obesity and all of that. But there was so much pushback from the parents, especially with the obesity. And now I think it's it would be better if we were doing more of that to address the obesity issue. But that patient values or preferences and values, it's like, well, they don't really want us to be getting in the business. So.
Yeah, right. It's a tough line there, right? You don't want to insult anyone, and we do know through weight loss in kids is it has to be supported by parents, and so parents have to be role models as well. So does that mean the parent has to lose weight too? So yeah, it's tough. And when we talk more about theories after we finish with this EBP with healthcare theories, that's a lot of theories that show those relationships between patient preferences and weight loss, and involving the whole family.
Yeah. So now, what clinical expertise would be evidence from patient assessment as well as use of healthcare resources? What does that mean?
So an example, as well as use of healthcare resources. So we probably know that everybody would benefit from having a care manager, right? But can we afford it?
Okay.
So that might be taking that fiscal, the resources, how much do they cost? Thinking about.
Got it. And what the bottom line is, if there's enough of an impact to make it make sense financially.
Right.
Okay.
Yeah. So.
Okay.
An example of that. All righty. So where were we? We're back on our little search here. So you'll take a peek at all of these abstracts, and then you will say, should I include them or exclude them? So take notes of what you're including and excluding, and then that you will kind of enter into this Prisma diagram. So this is where you can say number of records identified through the database searching. So this is with your keywords and with the limiters. So you're not going to say, oh, I found 280, but then I decided to go the last 10 years, and then I decided to go peer review. It's where the number of records with all those filters in it.
Okay.
And so then you say number of additional records identified through other sources. So these other sources are actually used quite a lot, is where you read the references in an article that you found. So say we're searching in here and we say, well, this doesn't really fit this one here, but it looks like it might have some good references about the topic that I'm looking into. So you go to this article and you look at their references. You might find some articles just through looking at the reference section of this one. So you can then go and pull up, search that article and pull it up and see what it says.
Okay.
So then if you search multiple databases, you're going to take away any duplicates. Number of records screened. That is just what you did when you were looking at the abstracts, right? So you're not looking at the whole full text article, just the abstracts. And the title sometimes will tell you a lot. So just from this, like you might say, if you just want to look at the U.S. and you see a study that says, what is the impact of care management on global school outcomes? You say, well, I just want to look at U.S., so I'm going to exclude that. So then you have what eligibility, number of full text articles assessed for eligibility. So this is when you read the full text. And then you say, okay, from reading the full text, how many of them do I keep and not keep? And then you're going to say, how many studies was I left with? How many of them were qualitative, quantitative? Maybe they were review studies, meta-analysis, systematic reviews, mixed method. So then you're going to say, this is the final number I'm left with. So this final number might be anywhere from 10 to 15. But then in week 10, what we'll do is actually go in and do an in-depth review, critical appraisal of 4 or 5 of those 10 to 15 that you found this week. Does that make sense?
Yeah. Okay, so just to recap at the very top, so you've searched 3 databases would be sufficient, do you think?
Yes, okay. Especially if one of them is Medline, because that contains a lot of other ones within it.
And then, so say you get 20, so when we were narrowing it down, adding more limits, we were looking for maybe 20 or 30?
Yeah, I'd say, even 15, maybe the maximum.
Okay, so really narrow it down with those keywords so that maybe in total we've got 45 or 50, maybe 60 that we've now, that's our number of records, and we take out the duplications and then we screen those ones and come up with 10 or 15 good ones.
Right. Okay. Say, I was thinking of someone like Howard has an example where he's looking at, should we use backboards or not, or something like that. So say he, for that's really, pretty concrete. There's, backboards and outcomes, and there's not a lot of other variables in there, like the time somebody's on it. So he might just find like, okay, well, I only found 3 studies, and so he might have a very small amount, where if somebody's looking at, what's the effect of, I don't know, something very general, weight loss and diabetes, you're going to say, okay, well, I found, 100,000 articles. So that's where you're really going to want to filter, and even down to a specific age, like you have school age. So that's, why you only have that many records. But, just want to keep filtering. You might put in an ethnic group. You might just want to go to USA. You might, if you have such a broad category like that, just, say I'm only going to look at systematic reviews.
Okay. So the work I've done already, which was a lot, wasn't exactly like this. Can I still think I need to search more to balance out my asthma to see if there's some diabetes stuff. I think I'll just have to sort of, I came up with thousands and thousands of articles, and I didn't narrow it down like this. Or do you think I need to just go back and start over? Because I think I've got some good quality stuff.
I think you can use what we just did right here, and then I can tell you that unless you're doing a systematic review, these numbers aren't going to be very exact. Okay. I'm just going to pull up for the, just to give an example. So this is what I did for my integrative review. It said number identified through database searching was 33, and after duplicates removed 29. Mm-hmm. That was not an exact process, and I think it's very hard to have this Prisma diagram say exactly what you did. So okay. I think as long as you do a pretty good job of explaining how you got to your final one, then that's good enough. These are not going to be exact, and I'm not expecting that for that.
I won't put my original numbers. My original numbers were in the thousands, but so I won't put those. And I will go back and plug in like these keywords. But yeah, I don't want to lose what I already worked on yesterday just for the sake of the diagram.
Yeah. Right, and even if you say, okay, well, I found 4, but then when I went through all the references, I came up with, 15 as my total or something. But okay. The other thing, you have to do, part of the EBP assignment is to narratively describe this whole process. So in the slides that I'm gonna send for you guys, I'm just gonna take, I did an integrative review that was published, and I just showing an example from that, how I went through and inclusion criteria, blah, blah, blah. So, if you combine a pretty good job of doing this and this, something that makes sense, that's fine. I just want you to understand how to do it. So I know this all can be a lot of work. So, just do your best with that. I don't think you really need to go back and redo all your searches.
Okay. Does that diagram, the Prisma diagram, is that something, is there like I'm not great with computer stuff. Do you have like a Word doc of that we can just plug into?
Yeah, there's some resources too in, Let me see, if we go into Sakai, and this is going to be what, week
This
9?
is week 9.
So, Prisma. I thought I had an example of how to do that. I can upload a resource where, but there is something. Hold on a second.
I read through that 27-page article on Prisma.
Oh.
I mean, I stopped halfway through. I'm like, okay, this is a little more in depth than.
Well, that's how you can see exactly, you know, if you're thinking integrative view versus systematic review, you can really see the difference in how rigid those systematic reviews are, where, you know, they get down to like statistical significance of how many research articles showed, you know, the independent variable was related to the dependent variable. So it's quite involved.
Well, what I did like, though, is the suggestion that they would, in the title of the article, that they would put not the conclusion, not the declaration, but put like it's a systematic review, or put a meta-analysis, put that in the title to make it easier for us, versus a conclusion, to make it easier for us who are searching. I thought that was a really
I know. Good yeah, that's easy enough, huh?
It seems like, I know, why make it complicated? Just say what you did and then we can find it.
Exactly. So here I found it in the assignment, and I'll put this in the slides. There's a little link to a resource that can help you draw these. So you just put in your information into here and it will spit it all out for you.
Okay, where did you find that?
So in the assignment tab in Sakai.
Okay.
For the EBP presentation.
Just keep scrolling down. Okay.
Yep, there's directions, resources, and then directions for each step, and then kind of a presentation guide. And within there, it has this tool for helping you create a Prisma diagram.
Oh, and that's probably where you said that's where you learn how to do the voiceover with the Google Slides. I remember
in here. Yes, right here. You're just asking me all these great questions.
I know. I'm sorry.
Yeah, but it's all right here. Yeah. So how to do the Google Slides, and there's an example video of how to do it that our instructional designer has created.
Okay.
So that's all in the Sakai assignment tab under this assignment.
Okay. Wow, thank you. I feel a lot better about the whole project.
Good, good. Yeah, I think it helps to specifically ask questions about your own assignment. I can give you lots of resources, but if you don't really apply it to your own, you know, situation, then sometimes it doesn't make as much sense. So, well, I'm glad you asked these questions.
I feel like I have stuff all over the place because I do, but there is a map. Like, I feel like I'm following some kind of treasure map here. Like, it is, I just don't know where to find it all.
Yeah, I'd leave you little breadcrumbs to follow.
Yeah. But anyway, thank you so much, Jill.
Okay, yeah, thank you. Okay. I appreciate you being willing to be on the call.
All right, bye.
Okay, bye-bye.